Today, we're talking about ovulation. Hey lovelies, Larissa J here from LarissaJ.com, and welcome back to my channel. For those of you who are new, welcome. Make sure that you subscribe. Now, for those of you who don't know, I mentioned in my last video that I've started a new series talking all about feminine health. So today we're actually going to get right into talking about ovulation. Now, if you haven't seen my last video, that video was all about tracking your period. If you want to check that video out, I'm going to go ahead and link a card up there for you so that you can look at that video as well. Before we get started, I do want to note that I'm not a medical professional. I just simply do a lot of research and utilize some of the things that I've researched regarding feminine health, and so those are the things that I'm going to be sharing with you today. However, this is not a replacement from any medical advice that you can get from your own doctor. Alright, so knowing when you ovulate is really important for multiple different things. For example, ovulation can let you know about your health, it can let you know about your fertility, and it can also help you with pregnancy avoidance and pregnancy achievement, all of which we'll talk about in another video. Today, we're going to get specifically into what ovulation is and how to identify it. So what is ovulation? Ovulation is a release of an egg from your ovary into your fallopian tube. This happens once a month. On average, this time usually happens about 2 weeks before your next period. Of course, this varies because everybody is different, but on average, that's usually about the time that it occurs, if you were wondering what point of the menstrual cycle it happens. Now, it's important to note that some people do happen to have anovulatory cycles, which is basically when you don't ovulate on a particular cycle. And that can happen to anyone. Occasionally, anyone can have an anovulatory cycle where an egg is not released that month. And that can happen from various reasons like lifestyle changes, diet changes, stress, health. Now, when it comes to health, someone might find that if they have anovulatory cycles on a regular basis, then that's definitely tied to health and should be checked out. But occasionally, some people do have anovulatory cycles here and there, and that could really just be linked to stress or diet or even excessive weight gain or weight loss. When we're talking about our whole menstrual cycle, ovulation is the fertile part of our cycle, and we'll talk more about fertility in a different video, but you'll have your period and then you have ovulation is the next step in that menstrual cycle. Basically, what happens is your estrogen levels increase, and then you have luteinizing hormones, which triggers your body to release the egg. How do you tell if you're ovulating? You can tell if you're ovulating through various different methods. One, you can pay attention to the symptoms of your body, which is cervical fluid. We'll look more into this in a future video, but you can use cervical fluid and the increase thereof as a way to determine whether or not you are ovulating. Another way that you can tell if you're ovulating is through your basal body temperature, and like I said, this is something that we're going to spend more time talking about in a future video. You can also tell if you're ovulating through ovulation tests, which they make, and simply by tracking your cycle. Now let's talk about ovulatory spotting. We know that ovulation comes, it's after our period, so period ends, a few days pass, now we're ovulating. We already know that ovulation is when the egg is released from our ovaries into our fallopian tubes as a result of estrogen levels rising and luteinizing hormone being released. Sometimes you'll notice some spotting, which is called ovulation spotting or ovulation bleeding. This does not happen for all women. In fact, when I was researching, I often read that it says about less than 5% of people actually experience ovulatory spotting. But for those who do experience it, ovulatory spotting happens during ovulation, where you might notice a little bit of spotting that takes place during that time. Ovulatory spotting happens as a result of the estrogen levels increasing as well as the release of the egg, and is usually pretty normal. Now, of course, spotting can happen other than just ovulatory spotting. There can be other types of spotting that women experience, and in those cases, you definitely want to pay attention to those because there can be other reasons why you are spotting. So if it's something that is not normal for you, that's something that you might want to look more into and maybe even seek medical advice on. If you pay attention to your body and you learn your body and you notice that through many of your cycles you're noticing spotting during ovulation, that could simply just be ovulatory spotting. Now, possible causes for bleeding outside of ovulatory spotting could be a variety of different things, from implantation in pregnancy to infections to health issues. And so that's why you would want to look into that if it seems like it's something that is abnormal for you. Thank you so much for watching this video. I look forward to seeing you guys in the next one. Bye.